Okay, now that we have successfully treated our spinal extensor muscles, then we have come back and treated the quadratus lumborum. Now we're going to be ready to treat the deeper muscles that are underneath the erectors, called the multifidi, and the paraspinals. The paraspinals are the muscles that are going vertebrae to vertebrae. Okay? Remember to review the anatomy on this. The multifidus is an important muscle in that it controls multiple levels, okay, with spinal extension, side bending, and rotation. It's oftentimes very sensitive, has trigger points in it. Research shows that it atrophies during back pain, so it's an important muscle to make sure that we're getting into and breaking up patterns, okay? And the next thing is understanding how those muscles attach. The multifidi are going to go from the spinous process and go a few levels down and attaching on the transverse process, okay? So multifidus, it's easy to remember, goes down a few levels at a time. Also very important here in the lower lumbar spine, again, remembering that the multifidus at the lower levels will go down and attach on top of the sacrum. So it is part of treating the sacral attachments. The muscles underneath that, they're spinal rotation-based muscles, oftentimes go from the body or between the spinous process and the transverse process, and they go down to the transverse process. So they go segment to segment, okay? So by trying to access this area, we're oftentimes going to get the multifidi and the spinal rotators at the same time. The trick to accessing them is making sure that we relax the superficial tissue as best we can. Now, we don't know if we're making true contact with these muscles because they are so deep. But the thing is, we need to realize we're going through a therapeutic protocol that is going to target them through the superficial tissues. If we can get around them, that's fantastic. Okay, but we're going to affect them in some way, either that through the tissues or making contact with them on the lateral or the medial aspect. Now, because these muscles are so deep and you're having to push through superficial tissues, if you don't have one, or maybe you do, we're oftentimes going to use a T-bar for this. T-bar, fantastic as usual for allowing us to put a little bit more pressure through some of the tougher tissues of the body and allow us to access the deeper tissues. But also very important outside of pressure is to reduce the amount of work that our hands are doing. It's much easier to sustain a position with using a T-bar, and in this application, it's one of the better things to do. So when we're dealing with treating the multifidus lies underneath the spinal extensors. So we really only have a couple of ways to access this. Now, pushing straight down through the erectors is oftentimes going to require a whole lot of pressure. It's not the preferred method to do this. Plus, oftentimes we're going to be mostly affecting the spinal extensors rather than the multifidus underneath. The other way of doing this is getting to the attachment points just lateral to the spinous process. Okay, that is something that we can do as well. And we can also access from a lateral direction medially, okay? And that's what we're going to be using the T-bar for. So I'm going to show you that one first. So what we're going to do is we're going to identify the lowest vertebrae possible, which is usually going to be at about L4, okay? Some people it's going to be between the interspace of L3, 4. That as we glide over to the side and we drop down just lateral to the spinal extensor, okay? We can feel right where we're about to drop straight down as previously for the quadratus lumborum, but instead of pushing down to get to the attachment of the quadratus lumborum, we're actually going to push at a 45-degree angle toward the opposite side of the abdomen, okay? That's going to allow us to slide between the spinal erector and, of course, the transverse process where the quadratus lumborum is, and that should help us access some of those deep spinal rotators, including the multifidi. So we're going to grab onto that T-bar. I located that space, okay? I fell right off of that spinal extensor, okay? But I'm not pushing down to get to the transverse process. I've got a 45-degree angle here, okay? So you want to take a good stance where you can get leverage, okay? And then just push straight down toward the opposite side of the table where his left abdomen is. And right there is going to be as good as it gets for identifying those deeper tissues. Okay, again, it's oftentimes going to be tender. We're going to pick up some of the side aspect of the spinal erectors, which is completely fine. As we hold on to that area with ischemic pressure, we wait for our release as usual. Okay, and then we're going to go to the next section. Okay, find our spinous process, fall off, and then push straight down at a 45. As you can see, some movement here. This is quite tender. Okay, so we're going to hold there, and then we're going to wait for our release. By now, the releases are going to come a little bit faster because we have treated so much of the superficial tissues, and the person should be well relaxed. There's a lot of blood flow into the area, less sensitivity and less guarding. Okay, so we're probably going to get one more, just like with the quadratus lumborum, have to be very, very mindful of the 12th rib. I drop off the side and I start to push down and in. And again, some guarding. Okay, so that's quite a bit tender. Okay, wait for that to release. Okay, now that we have treated that with the pressure bar going medially, we do have an option. We can go back if they're exquisitely tender, okay, and do more ischemic compression to get the sensitivity to drop a little bit more. We can do 1 to 2 more rounds, okay. The other option is doing some cross fiber here, okay, and I would say cross fiber, those fibers are going kind of at a lateral angle, so we are going in a direction, but we're actually going from inferior to superior and superior to inferior. To some degree, we're going to cross fiber them, but it's not a perfect angle. Okay, so we can go back to that contact point, and again, this technique is a lot harder to manage. It usually takes 2 hands in order to do the cross fiber. Okay, so what you have to do here is push down and in, and use your opposite thumb to guide the T-bar. So we push down and in, guide with the opposite thumb. So we keep guiding, and again, it's quite tender here, and our goal is to get 5 repetitions. Down, and then gliding up. Down, gliding up. Okay? We can reposition, and because, again, depending on the person, there may be a very small amount of space between the ilium or the iliac crest and the 12th rib, it might be very difficult, or we might have to use very short strokes in order to cover using this gliding technique. So push down and glide. Down and glide. Okay? Okay, and then we've got our treatment. Now we can move superior to inferior. So I don't have to really change position. I'm going to take up some skin toward the top. Okay, and I'm going to trade with my left hand, even though I'm not as good with the left, just for demo purposes. I push in, okay, and then guide with the right thumb. Very sore, seeing a lot of movement here on the table from our client here. Okay, so I'll ease off just a little bit so he's more comfortable. Okay, and then we'll reposition. We don't have a lot of space here. Okay, and then we've got our 5 glides. Now, when we move up to the next section here, okay, and we jump on top of the ribs, it's going to be a lot easier to do our work, okay, because we have more space to work with. So here, we just need to rest essentially the T-bar on top of the ribs. Okay, and what we're going to be doing is pushing, once it's rested, sliding that tissue, compressing in and down. So we're moving at that roughly 45-degree angle. So we're pushing that erector system out to the side so that we can access our deeper fibers. Okay, the first thing I like to do again is static compression, ischemic compression on this one, waiting for a release, and we're going to continue our process moving upward. So resting the T-bar on the ribs, and then gliding medially. And you're going to be hooking into those extensors or those erector muscles and pushing them medially to try to get underneath them to where the multifidus is. Now, the multifidus doesn't necessarily span throughout this entire section of the spine, but we are going to do the treatment as much as it makes sense to. Some areas that are so thin, okay, we don't want to just be grinding on the ribs, so we can be much more gentle in that area. You can switch to a thumb grip, okay, if you like, but the idea is still the same. Okay, and then we glide medially there, and that's quite tender. And I am going to go pretty much all the way up here, as much as I feasibly can. And here is a little difficult to use the bar, so I'm going to switch to my fingers, okay, and then glide and push medially. Okay, in each of these areas, I'm doing this in a little bit faster speed than normal, but this is the idea, okay? Lateral, erectors, sliding medial, so we can affect those tissues. There's a lot of other tissues as we get up here that we're affecting as well, okay? We are going to get some of the trapezius, we're going to get the rhomboids, okay? But that's okay. Okay, and they're going to go one more level, again working down to approximately C7, T1. Okay, now we have the option here of going back as we did with the lumbar spine, compressing inward, and then going, okay, in this case I'm going to go inferior to superior for 5 glides. Okay, and we're going to move up. Compress in, right, 45-degree angle, glides. Okay. Again, be mindful here of the trap. Okay, we're going to get some of the lower trap. That is not the extensor. We want to go around that. Okay. All right, and we've got one more here. Okay, and then we can repeat superior to inferior. All right, so we're going to go back to the top. And again, in this area, it's a little tougher to use a T-bar. Okay, it's more clumsy. It's easier to use your fingers in this area. But again, if your fingers are tired, or if you have some other thumb-based device that can work well in this area, then you feel free to use that. Okay, as long as we're making contact with the appropriate tissues and we're getting that 45-degree angle and we're going toward the spine. And, of course, we're being thorough, right? Of course, as always, connecting and communicating with the client and making sure that we're identifying any areas in particular that are very sensitive, okay? And that's how we're going to address that. Now, accessing these tissues on the medial side next to the spine, we can drop into the space between the spine and the erector, okay? Now, this is going to require a lot more thumb effort, okay, which is oftentimes challenging at this point in the routine, especially if this is not your first client of the day doing a back routine. You can use your thumbs in that inner space, okay? Or we can use a T-bar. Now the T-bar second option here outside of the rounded tip is the beveled tip. The beveled tip is going to be a much better selection for treating this area. Okay, this is fairly easy. What we're going to be doing is now we can start a little bit lower on the spine down here, okay, down all the way directly lateral to L5, the spinous process. Now what you want to do is to feel where the spinous process is and place your beveled T-bar just lateral to it. And as we're just lateral to it, okay, we can feel that we're almost pushing the spinal extensor laterally. Okay, so we're right in the middle between the spinous process and the extensor. Now from here, again, we want to be a little bit more careful because we're right on the center of the spine. We don't want to be putting too much extension force straight down, all right? So right here, we're going to just push down, always keep in communication with our client and make sure that that pressure is going to be about a 6, maybe a 7 max. And here I might err toward a little bit of the lighter side, maybe a 5 or a 6. So once we compress down, okay, here we can do our glides, just go right to the cross frictioning, okay? And making sure we're not just gliding the skin, make sure we're kind of scooping down to get some of that deeper tissue, all right? Reposition, and this is going to be a nice long road here of doing these 1/2 inch to inch cross-frictioning movements going all the way up to the top of the spine, lower cervical, upper thoracic. But it's well worth it, especially to make sure that we are thorough and we cover all of these tissues. You're going to be noting areas in particular where it's much more tender and sensitive, and these are areas that, again, we can come back to. And you're oftentimes going to find some surprising areas, and for some clients might tell you that this is an area where they are in particular feeling that there has been a long-term problem there or sensitivity, and it has never really been fully made contact with. So any therapies or massages or techniques that people have done in the past have not been able to access that section. And that is a very good thing to hear as a therapist, because it means that you're doing a good job with the thoroughness of your work. Okay, and I continue my way up, again getting a lot more dense in this area actually in particular. Okay, and just make sure that we're moving next to the vertebrae. We're right up against it. Okay, so we're getting those attachments. And of course, just basically pushing that extensor set laterally. Okay, and we'll keep going here. Okay, we got about one more level to go here. Okay, and then we'll reverse the motion and then go downward. So again, you'll notice that this is quite a time investment here to get this area treated. But again, it's not a thorough treatment of these tissues until we go through all of these steps. Okay. Work my way down and keep repositioning my body for ergonomics. I'm sure this is not exactly ideal, but just want to make sure that I stay out of the way for the camera. And there's a lot of overlapping procedures and things that you can do with your hands to limit stress. Over the years, I've found a number of different ways to position my hands or my body in order to reduce the amount of stress that my hands are getting. Even when using a T-bar, oftentimes you'll feel that your hands are getting a lot of stress because you're trying to hold the T-bar without wanting to, of course, roll onto the spine or create unnecessary discomfort for your client. So you might want to experiment with a lot of different types of tools for your own personal preferences. Okay, we got a couple more here. And last one. And at the very bottom, I'll be gliding up onto the sacrum, and I can feel that as I get to the bottom of L5 and I start to scoop up on top of the sacrum. Okay, and we'll get the rest of the multifidus attachments as we start to treat the ligaments on top of the sacrum. But that is how we're going to address those deeper layers underneath the spinal extensors, including the multifidus and the deeper rotatory muscles of the spine. After we finish that side, we're going to go right to the other side, and we want to treat that for a complete and thorough treatment of the deep muscles of the spine.